Welcome to Farm and Home. I'm your host, Brandalyn Reddick, and today we are meeting with Dr. Jasinski. We're here to talk about mental health in regards to students as they are heading back to school. What are some mental health challenges that young students might be facing, whether they're in preschool, school-age students, or even college students?
There's a wide range of experiences that folks can have with mental health, but transitions are a particularly vulnerable time for kids, for adults, for all of us. And going back to school can be a difficult transition. Certainly there are, individuals experience symptoms of depression, anxiety, ADHD, their behavioral problems, substance use. Bullying and cyberbullying are significant contributors to this, but there's also academic stress, the pressure to perform, and just concerns about social integration and having a social group, a peer group that you feel comfortable with. All of those things during a transitional period can mean that folks are at risk for higher symptoms of distress. And that could mean stomach aches or headaches. It could mean feeling down or stressed or overwhelmed, sleeping more or less than usual. All of those things can be signs that something is stressful and that the person is maybe needing some additional support. And we've seen a significant increase in suicidal thoughts, especially among youth. I think it's really important. This statistic that stands out to me is that suicide is the second leading cause of death for 10 to 34-year-olds. So our adolescents, our youth, are experiencing suicidal ideation at a very high rate. In fact, 1 in 5 middle schoolers or high schoolers has seriously considered suicide. And about 10%, 9 to 10% of adolescents actually have attempted suicide. That's a significant challenge for us. These are preventable causes of death. So UK plays a really important role in terms of treatment. We have inpatient services, emergency services, we have outpatient services, and we provide lots of intervention to individuals who are struggling. But we also play a major role in prevention. We want to prevent people from ever having to come into the hospital for depression or anxiety. And so the Healthy Kentucky Initiatives group has spent a lot of time developing tip sheets and information and awareness for families, for kids, to help everyone understand what some of the risk factors are for mental health challenges, how to get help, what it means to ask questions about suicide of your kid or your family member, your loved one. And so there's lots of free available resources in the communities, and UK Extension offices are particularly helpful. There's one in every county, and so they can house resources or direct folks to get to resources if they want to learn more about mental health and how to prevent some of the challenges for their child or for their loved one. And if you are aware of the signs and symptoms, if you're aware that someone's behavior has changed, maybe they've become more withdrawn or something is going on with them, all of us need to be comfortable asking the questions of, are you okay? And many times I hear people tell me all the time, I didn't ask because I didn't know what to do if they told me they weren't okay. And so UK has lots of resources, tip sheets, and trainings available so that folks do know what to do when someone says, I'm not okay and I need help. And that makes us all more comfortable in asking these questions. As youth, even all the way through college students, return back to school, they're out of the home, they're interacting with lots of different people, and that gives us all an opportunity to help intervene and provide support to that person before we get to a crisis. So QPR is Question, Persuade, Refer. It is a training that's freely available online. It takes about an hour. And it's much like CPR, that it trains us how to ask questions. How do we ask about suicide? How do we talk about suicide? And then it trains us, what do we do if someone says, yes, I am having thoughts about suicide, and gives us a really good comfort level in the community that we have first responders available for mental health crisis as well. So the QPR training is freely available. The website is kyqpr.ukhc.org. And on that website, you can access the QPR training free. There's also a link on the bottom. Those resources are tip sheets and other information that's readily available on stress and sleep and working with screens and bullying and all sorts of topics. 988 is always available. And you don't have to be in crisis to call or text them. It can just be that you need support, and that's an awesome resource available everywhere.
And thank you for joining us on this edition of Farm and Home.